With fall sports almost in full swing, let's put some parents' mind to ease and focus on preventative measures for your athlete and even yourself that you can implement to help ensure you are healthy and ready to take advantage of the fall season. Joining us now is CHI Health Primary Care and Sports Medicine Doctor, Evangelist Giacomanis. Evangelist, thank you for joining us today.
Thank you for having me.
All right, doctor, is this the busy time of year for you?
Yeah, we're kind of going through the sports physicals and starting to see some injuries coming in as well.
Yeah, when it comes to sports physicals, why are those required?
A big part of it is making sure that the athlete is tuned up to make sure that everything is up to snuff, in the sense of making sure that if there's any sort of history that maybe has been overlooked, sometimes that can lead to some unfortunate outcomes, and we want to try and avoid those.
For a young athlete or parents of a young athlete who maybe haven't had a sports physical before, what can they expect when they go in for an assessment like that?
There'll be a lot of questions about the history of the athlete, namely looking at any medical emergencies that may have occurred in the past. They'll also ask about some family history as well. Ultimately, we're looking to make sure that the cardiovascular health of the athlete is at its best.
Yeah. From a doctor's perspective, what are some of the best things that an athlete can do to take care of themselves during the off season, so to speak?
Yeah, so like you mentioned before, prevention is a big key, and for primary care sports medicine, that's one of the things that we really advocate for. A big thing is making sure that you're well hydrated, you're wearing the appropriate equipment, appropriate attire for the activity that you're going to be performing in. That includes footwear, because ultimately being able to avoid an injury will allow you to perform through the whole season.
What are some of the most common avoidable injuries that you see in your office?
The ones that I think are the most avoidable usually are like muscle strains and pulled muscles, things like that.
Yeah. What can we specifically do to prevent those?
So like I mentioned, hydration is very important. Another one's very old school, but stretching. A lot of the coaches now, they're starting to incorporate things like dynamic stretching, which evidence is starting to show that's a little bit better than more of the static stretching that we usually see on TV, or we're all sitting in a circle and stretching with the coach showing us what to do. But that's a big one that can kind of help, and a good warm-up as well.
For those unfamiliar, what is dynamic stretching, or an example?
So aside from like sitting or standing and trying to really stretch out that muscle with the movement that you're trying to elongate those muscle fibers, dynamic stretching will incorporate some sort of movement that kind of emulates what you may or may not be doing in the sport that you'll be participating. And when you're doing that and making that movement, you're actively stretching that muscle with the activity that you're doing.
Okay. Makes sense. From what you've seen, what are some of the biggest changes in sports medicine over the last decade or 2 decades? Is it recovery time? Is it prevention?
Prevention, I think, was always there. I think a big part is the recovery time. There's a built-in aspect of it that we're all human. It takes time for injuries to recover, and I know we're very eager to try and get back on the field, but sometimes we gotta give it some time. But that's where sometimes being able to go in and see a professional, they can kind of help navigate that to hopefully expedite that process and hopefully get you recovered and back to playing sooner.
So I'm sure you see a lot of twisted ankles. When does somebody know that it's a twisted ankle, and I'm just using this as an example, but twisted ankle versus sprained ankle versus broken ankle, when do you know it's time to go to the doctor?
Sometimes you just know that something feels off. If you've given it enough time and the symptoms really aren't getting any better, or your symptoms have plateaued after like a couple of days and they're just not getting better. Something as simple as if you're not able to put any weight on it, and after a few days, something like that, those are usually your warning signs that maybe you should get checked out by a professional.
Yeah, maybe trust your gut too, right? Yeah, okay. We got about 30 seconds left. For people who are ready to hit the court, to hit the field, what's your piece of advice heading into the fall?
Have fun. when you're having fun, usually you're more eager to take part, and this is where we call to making sure that you're doing what you like to do and you're enjoying being active and having a healthy lifestyle, which has a lot of health benefits.
All right. Doctor, thank you so much for joining us today.
Thank you.
Remember, if you missed any part of this show or you want to watch it again, it's available on the very local app. All KATV News Watch 7 reports are there on demand, and it is always free. You can download that app for Roku, Amazon Fire, or anywhere you find news apps. Football, volleyball, cross country, boys tennis, girls golf, bowling, and softball. They all soon start competition, some as early as later this week. We hope you're ready and a little more prepared for the fall athletics season and for the rest of the school year to come. I'm Bill Shammert. Thanks for watching KATV News Watch 7's Chronicle. We'll be back here next Sunday morning. See you then.